Hi, welcome back to another session about your health. I'm here to explain a medical condition called prediabetes and how to manage it naturally. I'm Dr. Chitra, a medical doctor working as a general practitioner near London. Prediabetes is a health condition where blood sugar levels are higher than normal but not high enough to be diagnosed with diabetes. Prediabetic people don't have any symptoms, so 80% of them may not even know they have this condition. Among the population, every 1 in 3 adults has prediabetes now. Why do we need to care about prediabetes? People with prediabetes are at high risk of developing diabetes within 10 years. Prediabetes increases your risk of developing heart disease and stroke at a younger age. A good news is that prediabetes is entirely reversible with some lifestyle changes. So in this video, I will explain who is at risk of getting prediabetes, how to find out the diagnosis and manage them effectively. I recommend that the following population must have screening tests for prediabetes from 40 years of age because they have a high risk of developing diabetes. Please get a screening test if you are overweight, that means your BMI is more than 25 or there is excess fat around your tummy. I will explain the BMI and recommended waist level further in this video. You are at risk of prediabetes 2 to 4 times more than the average population if your parents, brother or sister or your child have diabetes. A specific group of people are more at risk of diabetes. For example, people of South Asian descent, just like me, and African Caribbean or Black African descent has 2 to 4 times more at risk. So these population must start the screening test from the age of 25. Some medical conditions put you at risk of developing diabetes in future. For example, if you ever had high blood pressure or a female who had diabetes during pregnancy or polycystic ovarian disease. Last but not least is people who have a sedentary lifestyle, which means those who walks less than 5,000 steps per day or who sit and work for more than 7 hours with less physical activity. They are at high risk of developing diabetes in future. After COVID, most of you are working from home and have reduced physical activities, so many of us may already have prediabetes. I recommend that these high-risk people must have a yearly blood test to check their blood sugar and write it down in a record to see the trend of your blood sugar level every year. Well, how to find out the blood sugar level and what must be your blood sugar level? There are various methods to check blood sugar level. In the UK, we use a blood test called HbA1 to check blood sugar, and many countries use fasting blood sugar to check blood sugar level. If HbA1 is 42 to 47, that is 6 to 6.4%, or fasting blood sugar is 100 to 125, confirms that you have prediabetes. Not to panic, there is no need to start any medicine to bring the blood sugar to a normal level. The best management plan for prediabetes is to bring your weight to the recommended level of your height. Losing 5 to 10% of your body weight significantly reduces your risk of developing many major illnesses. In the UK, we give structured educational program to people diagnosed with prediabetes or diabetes to bring their weight to recommended level by changing their lifestyle with the help of healthy eating plan and regular exercise. So what is a healthy weight? The following simple formula can check whether your weight is ideal for your height. BMI, body mass index, is the best way to check it. You need to weigh yourself in kilogram and measure your height in meters. Use the link below to open the chart and find out your ideal weight for your height. The ideal BMI is less than 25, but people of South Asian descent and African Caribbean or Black African descent need to keep their BMI less than 23 due to their high risk. Moreover, you must measure your waist to ensure you don't have excess fat around your tummy. To measure your waist, find the bottom of your ribs and the top of your hip. The midway between these two is your waist. Breathe out and take a measurement. It needs to be less than 94 cm for men, and for women it needs to be 80 cm and below. About exercise, we recommend 150 minutes of exercise per week, split into 30 minutes daily for 5 days per week. You should start with 10 to 15 minutes of exercise daily and slowly increase the duration. Healthy eating and exercise is a big topic which we do in a many week program in UK. I want to explain healthy eating and exercise in detail instead of rushing. So I will explain various healthy eating plans that suit your food habits in the future. I will also explain how to gradually build an exercise regime that fits your lifestyle by doing it at home. So take home message is: do a regular blood test every year to check your blood sugar level and keep a record of this. Weigh yourself and measure your waist at least every month and ensure your weight and waist measurements are healthy. Next, I will start with the early symptoms of various cancers from the following video. I believe every one of us must be aware of these symptoms because when we diagnose cancer early, we have multiple treatment options to cure some of the cancers. If you like this video, please subscribe to this channel and click the bell button to continue your healthy life journey with me. Thank you.